According to the Centers for Disease Control and Prevention, in 2020, about 2.7 million Americans were diagnosed with opioid use disorder, more commonly known as OUD. The opioid crisis has negatively impacted people's health-related quality of life, leading to reduced productivity and increased healthcare costs, putting a heavy burden on our nation's economy. Drug overdoses have claimed over 1 million lives over the past 22 years. In the past 5 years, more than twice as many people have died from a drug overdose than from a motor vehicle accident. The rate of drug overdose deaths involving synthetic opioids other than methadone, which include such drugs as fentanyl analogs, and tramadol, increased by 56% from 2019 to 2020.
More Americans have died in 1 year from a drug overdose than from the wars in Vietnam, Afghanistan, and Iraq combined.
New data shows that opioid overdose deaths continue to climb, taking the count from 68,630 in 2020 to 80,816 in 2021. These are not just numbers, they represent lives lost, families affected, and the nation losing its human capital.
Drug overdoses within a city, on average, I would say we get 20 to 30, just depends on the day. I'd say 2020, I think we had 859 fatal overdoses just in Franklin County. 2021, there was 829.
Opioids include prescription medications used to treat pain, such as morphine and fentanyl, as well as illegal drugs such as heroin and illicit potent opioids such as fentanyl analogs. Opioids work by binding to opioid receptors in the brain and spinal cord, helping to diminish the body's perception of pain. However, these opioids could also produce euphoric effects and could also negatively affect other bodily systems. Opioid addiction is characterized by increased cravings in the brain's reward pathway, leading to compulsive drug-seeking behavior despite the many consequences. According to CDC, in 2021, 75% of drug overdose deaths involved opioids. The opioid crisis is my top priority because even after 22 years, the situation is only getting worse, which demands that we as a nation need to do even more in our fight against OUD. Healthy People 2030, a national initiative to improve the health and well-being of people, targets to reduce overdose-related deaths from 21.4 to 13.1 per 100,000 population by 2030.
According to our West Virginia Bureau of Children and Families, approximately 82% of the children who are in foster care are there because of parents with substance abuse-related issues.
The overall economic burden of the opioid crisis in the U.S. was estimated to be $1 trillion in 2017, with $471 billion attributed to OUD and $550 billion to fatal opioid overdoses. A paradigm shift in our outlook towards opioid addiction is required to better understand the problem. First, we need to stop considering addiction as a moral issue or a criminal behavior, and rather recognize addiction as a disease that affects the brain, limiting the individual to make rational decisions. ASAM, the American Society of Addiction Medicine, defines addiction as a treatable, chronic disease involving complex interactions among brain circuits, genetics, the environment, and an individual's life experiences.
There's a lot of stigma around addiction, and we often treat addiction like a moral failing or that people are doing bad things. But if we think about it as a chronic medical disease, like we think about diabetes or high blood pressure or asthma, it's very much the same. And when I say that, I also mean that it's, a chronic condition, but it's also treatable and people can get better.
The chronic disease approach says, if you hit a rough patch, we're going to give you more resources. We're going to try even harder.
Individuals with OUD face multiple challenges, like mental illnesses, untreated infectious diseases, homelessness, unemployment, lack of social support, and involvement in criminal justice systems, requiring an integrated approach to treat it. Substance use disorder is one of the most stigmatized health conditions. Stigma surrounding addiction can cause individuals to hide their drug use, which can lead to social isolation and solitary drug use, both of which increase the risk of an overdose.
Us saying to them, well, you can use a fentanyl test strip on your drugs, is not us giving permission to use. It's saying, I don't want you to use, but if you're going to use, I want you to make sure that that drug won't kill you. So that if a person does overdose, we ask that you call 911 and dispense Narcan.
ASAM recommends that federal and state policymakers should fully fund evidence-based addiction treatment and recovery support services. The concept of long-term addiction care and recovery as an ongoing process should be reflected in national and state-level quality of care measures. Due to the complex nature of addiction, a coordinated effort involving diverse stakeholders in public health, education, law enforcement, research, and the healthcare system are pivotal in the fight against opioid addiction. Working closely with other policymakers and administrators, I advocate for strengthening the addiction workforce, policies that remove stigma and discrimination, and removing structural barriers that prevent equitable access and coverage to high-quality, comprehensive addiction care. Along with all the money and all the resources that we put into this fight against addiction, it is crucial that the stigma surrounding it must be eliminated for us to make any meaningful progress towards a recovery. Otherwise, we stand to lose a generation.